Hello and welcome everybody to Revive Health's Daily Briefing Live for Tuesday, March 31st. This is our 30-minute review of the latest and most important news, resources, and advice for health system marketers and communicators dealing with COVID-19 crisis. I'm Chris Bevelow, Health System Practice Lead at Revive Health and your host for the show. I am joined as always by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hello again, Chase.
Hey, Chris. Good to see you.
You as well. And we're also joined today by Elizabeth Musson, who is SVP in our communications group at Revive Health. Elizabeth has a diverse communications background, including comms planning, executive visibility, internal communications, media conferences, integrated campaigns, issues crisis, and mergers and acquisitions. Hi, Elizabeth.
Hey, Chris.
Thank you for joining us on a day that we shall celebrate as the end, as what I think I said in the prep to the show, of the worst month that we have all maybe experienced as a country in quite some time. Is that a fair way to phrase this?
That's accurate. Cool. Happy to say goodbye to March.
Good riddance, good gravy. And I don't know that April's going to be like supercalifragilistic or anything, but at least we're a little prepared for April. We're like, know what's potentially coming, whereas March was a shock to the system as much as anything. So good riddance to you, sir. We will not miss you. All right. So thanks for joining, Elizabeth.
Happy to be here.
So with each show, we plan on covering the latest news on COVID-19, how it relates to you, marketing communications folks at hospitals, health systems, and their provider organizations. We want to also make this a forum for interaction, for questions. So please use the Q&A queue, which is at the bottom of your Zoom window, to ask us any questions. You can put questions in there at any point during the podcast, and we will take time to answer as many as we can at the end of the show. You can also use the chat function of Zoom if you want to communicate with other attendees. But if you do want us to answer a question, make sure it ends up in the Q&A queue. Chase will also be dropping relevant links as we discuss them throughout the show in the chat queue. So you can look at things right away. And of course, we'll be providing those in the show notes. As always, we will have a recording of this episode along with a recap, which I haven't mentioned. We've been doing a recap. So it's easy to kind of just glimpse what we're talking about each time. That's at our website. You can, of course, just go to thinkrevivehealth.com. We have a banner at the top that leads you to our communications hub on COVID-19, or you can go to thinkrevivehealth.com/COVID-19. And we are now available on iTunes. So you can subscribe there and have this podcast delivered to your listening device of your pleasure whenever you need it to come. So a couple of important notes we always hit. We are not experts on COVID-19 in terms of medical or scientific viewpoints, so not a place to come for that information, but we do have opinions on what you as marketers and communicators might want to be doing in terms of managing the COVID-19 crisis at your organizations. Just keep in mind that we are speaking kind of writ large, and everybody's situation is different. So you need to take your community's situation and your own organization into context as you think about what we are talking about today. So let's dive in. We've got a couple of things, actually three things in news. The first, of course, is we want to kind of give a context point for all the things we're talking about. And we do that by looking at the case count every time when we start the show. And we do that because it helps put everything in perspective in terms of where we're at on the upswing, and hopefully soon in April, we're hoping we start seeing us shift to a downward trend. But everything we talk about should be in the context overall with that kind of progression of the disease and the virus across the country. So internationally, by the way, we use the Johns Hopkins University tool. Internationally, we are now at 823,479 cases and 40,636 deaths total. Just in case anybody cares, Italy is still far out in front of deaths. Super unfortunate. They have basically almost a third of all the deaths in the world. Spain is right behind them. So between the two of them, Spain and Italy have half the deaths in the world. So it's just super sad what they're dealing with there. From the United States standpoint, we are now at 175,067 cases and up to 3,415 deaths. And we continue to, in terms of case count, accelerate past the second closest country, which is Italy. I would expect if things continue, we will be double Italy maybe tomorrow or the next day. So that trend to change as soon as possible. So the other thing we wanted to try, I'm going to try to get into the habit that is appropriate for coughing. I want to assure people that when I cough, other than when I'm in front of this, I'm always going to my elbow. But as I've told people, the first time I did that, I knocked the microphone over. So I continue to go to my hand and just display the wrong way to do it. So I'm going to try to do like a full like dabbing thing or something. Because I know it just sends the wrong signal every time. One of the things we're going to talk about in a little bit is how health systems are dealing with social media in terms of their physician and staff. And we continue to see stories about kind of a hard approach to that. So there's been a story that broke recently about an ED physician at a Seattle hospital who became kind of a celebrity on social media for calling early and often for more supplies, for pointing out the shortcomings. Apparently he was kind of spoken to by leadership, but continued his communication, shifted a little bit, according to the story that I saw, less from criticizing his own organization and just in general, but nonetheless, they terminated him. And there's a story that came out, I think today in Bloomberg. So you can go to Bloomberg.com. It's titled "Hospitals Tell Doctors They'll Be Fired If They Speak Out About Lack of Gear." So it's a broader story on that. Understandable why you would want staff to restrain themselves, but also not sure firing caregivers is the answer. So let's hold on that, Elizabeth. I think we want to get to that a little more in depth in a little bit.
Yeah.
The other thing, though, is something that you added, and so I'm going to ask you to speak to it. And this is more just news from what we're hearing around health systems and in regard to PPE. So why don't you speak to that one?
Yeah. So I think from several conversations that I've had kind of late last week and yesterday and today is this question mark for hospitals around homemade masks. So there's definitely been a push, and I think it's really great to see the community. I think everybody's wanting to kind of support the people on the front line. I think we've seen a lot of the really touching images of signs that are up, the rainbows that we've seen in windows. I think blue hearts have been become kind of a universal symbol of the supporting healthcare workers. But I think there are also question marks around the safety of the mask, just things that may create some liabilities for hospitals. So would be interested to hear if folks want to use the chat function or kind of jump in at the end in the Q&A where their hospitals stand on this and how they're using homemade masks or redirecting the offer from folks in the community to help kind of how they're deploying that generosity in other ways.
Yeah, it kind of builds on what we talked about yesterday about health systems, how they're managing giving overall cash or whatever. Unfortunately, it's not just concern about donations from the community. I mean, we learned yesterday that a huge shipment of masks that came from the federal government to folks in Chicago were the wrong kind of masks. And we've heard other things like that. I don't remember where, and I'm sorry, we should not like quote things that we don't cite because that potentially just drives rumors and things that are wrong. We had that happen the first week, Elizabeth, where we touched on something that was happening live and it turned out to be inaccurate. We had to correct it the next day. But I did see a headline about a number of, well, certainly there have been reports of testing kits from China that are either faulty, or there was a report today about kits that I believe it went to New York that themselves were tainted with coronavirus. the testing kits. So it's not just community contributions. I think this is a concern no matter where supplies are coming from. So something we'll just keep an eye out for, because obviously as you deal with issues that crop up at your organization, if that were to come to light, you'd have to manage that, the communications and the crisis around that. So let's talk about resources real quick. Again, a reminder, we have a COVID-19 consumer survey findings report at our communications hub. That's at the same website I gave before. You can just go to thinkrevivehealth.com, and there's a banner at the top, so you can go find that. Again, I believe we are planning on rerunning that survey today, and we'll be bringing forward results, or at least anything worth noting in terms of changes, because it has now been 2 weeks since the first survey was run. And then another one from public opinion strategies. Liz, if you want to speak to this resource that you thought was helpful.
Sure. Yeah. The folks at Public Opinion Strategies, who are friends of Revive, folks that we've used for a number of different polling work. They have done, they're definitely doing their own stuff that's proprietary, but what they did and put out on Saturday, which I found really helpful, is they've looked at a lot of other polls, kind of compiled them into findings, pulling out key data. And we've actually been using that in a number of places to help our communications partners make the case for certain things with their executives. So especially around like how visible to get the CEO or other executives. But there's a lot of good data in there that supports this. What we also saw in our consumer survey around that consumers are really trusting that local health system, health leader for a lot of the information. So Chase has posted that, check it out. But there's lots of good data in there to make a case for some of the approaches that you might want to take with communications.
Great, perfect, thank you. All right, so let's dive into some things that we're seeing. And I think the first one, we've teased this out a little bit on the podcast yesterday, but Elizabeth, you've been taking a look at union activity, union communication. Understandably, we've been seeing a lot of news stories about particularly nursing unions speaking out about the conditions that their members are dealing with, which is, understandable. Why don't you share a little bit of what we're seeing and maybe some advice you'd have for folks who are facing that in the communities or the organizations that they're in?
Yeah, happy to. So I think there's kind of two sides of this. One are organizations that already have union representation. So I think we're going to focus a little less on that today and talk a bit more about organizations that don't have union representation. But for those that do, I think it's following those practices that you usually follow around really good communication, making sure that they're aware of what's happening, keeping kind of two-way feedback, being a resource. And so I think kind of following those guidelines, but making sure that, as with everything, the more you communicate and the more you have that back and forth, the better. But on the flip side, so those the groups that I've been talking to most in the organizations that I've heard from over the last couple weeks largely are the health systems that don't have union representation. So I'll talk a little bit about what they've seen, a little bit about how things could escalate, and then just some of the things that they can do to kind of get ahead of this.
Sure.
So I'll start first with kind of what we've already been seeing from unions. Pretty typical, I think, that when there are these disruptions that unions try to take advantage of. So we see it a lot around if there's an announcement around M&A, that they'll use it as an opportunity to kind of speak to employees, from nurses, kind of frontline staff, to environmental service workers. So you can kind of think of it as not just one particular group, but
right.
Some of the things we're already seeing are around social media, of course, on their own websites, certainly using things like Facebook. So posting on their own feed, kind of trolling through hospital feeds and commenting, running targeted ads. We've even seen where they're setting up new pages using In Virginia, there's a Virginia Nurses COVID informational group. It's got about 20, well, as of last week, it had about 20,000 members. And it had a really large representation of union folks that are from the union representing on there. So just things to be thinking of, like seeing what might exist within your own state or your own community there on Facebook.
So let me ask you something,
yeah.
Elizabeth, because I think as somebody who, this is not my area of expertise, so I'm coming from the outside. I think a lot of times when there's union activity and messages, it's not as clear cut who's right or who's wrong. So, for example, if there's labor negotiations and there's demands for pay raises or better healthcare and things, it's way more nuanced in terms of how the public might perceive those.
Yeah.
In this case, when you have for example, a nurses union who comes out and is talking, this happened early on. So this is something weeks ago, right?
Mm-hmm.
About the conditions their workers are having to deal with and the lack of PPE and all of that. And at the same time, we have people holding these folks up, rightly so, as the heroes of our world right now. That has got to change a little bit how we think about addressing these issues, right? Because it's really hard to look or hear some of those things and think, well, that message is just wrong. Or I'm not sure if I agree with what they're talking about. I would assume most people in the public would hear that and go, yeah, that's a problem. Like, we've got to get nurses what they need and doctors what they need, right? Is that a fair way to to think about the difference of what normally is out there?
It is, yeah. And I think we saw in one instance, a union went to a local paper on, a Friday afternoon at 4:00. Our client got a call from the local paper saying, hey, we have this list of 13 complaints. Can you respond to them? And it was a lot of less of what you see around, pay and time off, and some of the more just kind of general requests that the unions are making around a better work environment for nurses. And it's more specific to PPE, to protection of their job from furloughs or layoffs, or how when nurses that may not be have the training that is appropriate for treating patients with COVID, how are they being used and redeployed in other ways? So I think it's a really good point that it's all stuff that the general public would look at and say, of course we should do those for our nurses.
Right.
Yeah.
Okay, go ahead. You were going to make a second point.
Well, that was it. It was the local media. So we're definitely still seeing folks use local media running ads or submitting these kind of list of complaints to local papers to try to generate that support. This can escalate in a number of ways, just along as they typically do, and as unions are trying to make headway within organizations around material distribution. More media could show up outside the hospital, those things. So we haven't seen any of that escalation yet. I think there is, to your point, Chris, kind of people are being, it's a time that no one has seen before. So they're not being too aggressive in confronting, but they are laying the groundwork for at the appropriate time to really come in. So just the things that we'll talk about today are really just to kind of get ahead and prepare for sort of what comes next.
Yeah, that's what I was going to ask you, because I think from the union's perspective, taking advantage to a degree, I don't want to cast aspersions, but certainly trying to look out for their members, but also laying the groundwork, because I'm sure they also are trying to have a level of sensitivity to, this is a crisis. They don't want to become the target of any kind of vitriol. But when we come out on the other side of this, the messages are going to be, I can only imagine, extraordinarily clear and strong in terms of how things need to change in the way that they would want them to change. Going back to the things that we've been hearing, always have heard, pay, benefits, time off, all that type of stuff.
Staffing ratios.
Yeah.
Yep, I think that's right. So that's one of the things that, as we think about what you should be doing to prepare, it's the kind of being ready for those, like developing your standby messages, what we kind of call as our attack response grid. So what are the things where you have vulnerabilities as a system, and going ahead and thinking through how you can respond to those, what data you have. Are there things that will change coming out of this, this crisis that you'll need to account for, around staff safety, employee rights? I think hospital finances will be a big one, just because there's so much uncertainty of what relief there will be for hospitals. There's been the relief package passed, but we still remains to be seen how all of that plays out. So just being really thoughtful about that next step of what's coming. And then I think in the immediate, it's really all of the stuff that we talk about with just general communication, best practices around lots of good internal communication. Yeah. So really proactive, making sure that you're thinking through, like, emails aren't enough. Even in the best scenario, the open rate is still in the 20%, just because people either don't have access to them, or they've got so many things coming through that you just can't count on emails to be getting the message across.
And all the difficulties that we know that you already face, and having multiple shifts and all of that, and particularly now, it's just got to be, it compounds the difficulty in communicating with healthcare workers that was already a difficult kind of setup that everybody knows about. But what we're dealing with now just makes that even worse. So let's actually pivot, because I want to make sure we get to the second thing we were going to talk about today, because it is related to internal communications. And we've hit on this a little bit. We had Ryan Kolyani on. He's been on a couple times. We've touched on this, but want to dive just a tad deeper. So we mentioned the story at the outset of the show about the doctor, the ED doctor in Seattle, who was fired for continuing his social media communications. We know clients are dealing with this. It's a very difficult subject, because most likely most hospitals and health systems, if not all of them, have some form of social media policy by this time, I would hope. And usually that policy covers what we're talking about, but these are different times. And so when you have a nurse or a doctor who's using their own personal social media to communicate, at best, the need for supplies, but at worst, talking about the situation at their workplace, so your organizations, and even maybe casting negative opinions about how that's being handled, right? So it's one thing to say, boy, we're really struggling at XYZ hospital here. Just things are chaos, whatever. It's another to say, and leadership just isn't listening, or we keep begging, whoever to give us what we need, and they just turn a deaf ear. So the problem becomes trying to clamp down on that, because it can backfire. So if you go out there and you say, hey, remember our social media policy, and people are like, no, they're trying to shut us up. And B, how do you ultimately enforce it? Because if it gets to the point where you have to fire an ED doctor, you may be creating as much negative publicity as you were trying to prevent in the first place.
Yeah, and I would say you are probably kind in saying it could backfire. I think at this point we should assume that it will, that there are not, we have not seen any place where hospitals have really restricted what employees say, or forced them to follow the standard protocol of, media requests come through the communications department, where it has actually worked. I mean, and I think starting from just a place of empathy that, everybody, like, this is just a whole new world. You can kind of understand both sides, that hospital executives are also frustrated with the lack of supplies, but they're having to make sure they're being prepared for the future. So I think for me, this again starts with good internal communications. One thing that I think we didn't get to touch on with the unions that I think I'll touch here, because I do think it's also important, is when you're thinking about internal communications, make sure you're also accounting for the Spanish translations of some of those, so that what we're seeing sometimes is things internally are getting shared externally. And it's a really important, especially for some of the frontline workers, that we're finding that the Spanish translation is kind of being left behind, and it's creating a gap in information to get to internal and external audiences. But yeah, it's that consistent internal communication, acknowledging that things are changing. I think was talking with one health system where the leader was doing a great job conveying confidence in the training of their doctors, that, you know, they've got this under control, but not really acknowledging that there are risks to all of this. And it kind of came off as a little bit like just not recognizing the human impact to this. And so I think it's that communicating with empathy, acknowledging that there are changes, acknowledging how this might feel to people. And along that, giving people a voice in all of this. So give people a way to give two-way feedback that is not just an email. There's got to be some of that one-on-one conversation, talking with folks on the ground. What are they hearing? Monitoring your social channels, monitoring social in general, so that you have a pulse on things like the groups that are popping up. But I think really it's about what you were saying, Chris, of like, you can't just take the normal playbook and use it in this scenario. I think your best case scenario is to reach out to the people that are really active and try to get them to be advocates alongside you, to use their voice to advocate for what is needed, both within the hospital, but also in the community, and reminding, using their voice to remind the community that they have a role to play in this as well, by staying home, you know, social distancing, washing hands, all of those things.
Yeah, I think the best, at the end of the day, see if this passes the test. To me, there's kind of four different options if we're talking about social media employees, and then we'll wrap here real quick. One is you just stick to your policy and you send out a reminder, social media policy doesn't allow you to blah, 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 right? That's out.
Yeah.
The other option, though, is nothing, I think. That probably is also out, just not doing anything. Yeah. It's the two options in the middle, one of which is you try to restrict it, but you restrict it in a way that you say, look, help work with us here. We're trying to make sure there's not undue panic or rumors. You know, we are capable of helping people. And if we send the wrong messages in the wrong tone, we could deliver the message that we're not able to. So please, reminder, look at our social media policy, try to adhere to it. So you're still trying to put it in place, but you're using that empathy you're talking about. The other is the same kind of thing, but not even pointing to the social media policy, just saying, hey, we understand you feel the need to use your social media channels. Just, you know, again, work with us. Keep in mind, if messages are sent in the wrong way. So it's almost like an implicit, we're not telling you to stop, but just try to keep things in mind. I think it's between one of those two and your comfort level in terms of compliance, leadership, of which way you lean, because both obviously are not perfect, but it's somewhere in there. It's not not going to do anything, and it's not the wrapping on the knuckles.
And in both of those messages, reinforcing, you know, if you do have concerns, here are your channels to make sure we're getting that feedback. And when you are getting that feedback, being very clear, like, this is what we heard and this is what we've done to address that, or these are the plans we're putting in place to try to address that.
Right. All right, perfect. We're going to wrap. We're right at 12:30. So Elizabeth, thank you so much for joining.
Yeah, happy to be here.
Really appreciate it. Chase Kleckner, again, sir, thank you.
Absolutely.
Reminder that if you would like us to cover something, visit the website, visit the communications hub at thinkrevivehealth.com/COVID-19. You can provide feedback there. You can email me at cab@thinkrevivehealth.com. We always want to know what you guys are interested in. Tomorrow, we're going to be joined by Vicky Amalfitano, who former CMO at Brigham Health. also a consultant and a friend of Revive. She's done some work with us. So looking forward to having her there. Reminder that we will be posting a recording of this at our communications hub, and also it will be available on iTunes. So make sure you subscribe to the podcast there. Let others know who you think might find this valuable. And again, as we sign off every time, keep up the good work, hang in there. Ugly March is behind us. We probably have another difficult month in front of us, though. Hopefully that's it, and we will start to emerge from this sometime in April, if not early May. So keep up the good work. It's so critical what you all are doing. Communications, as we just heard, so important to your organizations, but also to helping us all get through this. So we'll be back tomorrow and every weekday until this crisis passes. Thanks for joining, and we'll talk to you tomorrow.
Thanks.